Every day, patients undergoing infusion therapy face the same issue: countless visits to the hospital or infusion facilities, neither which are comfortable environments. But with rise in technology, home care groups provide patients with the opportunity to receive intravenous treatment safely from the comfort of their own home.
I'm a home infusion nurse, and I've been doing this for the past 12 years. I have a Bachelor of Science degree in nursing from Fairleigh Dickinson University, and I worked in hospitals for many years before I moved into the home care setting. I really enjoy meeting with my patients in their homes because I get to know them better and get to connect with them on a much more in-depth level, and I can give them the level of care that they really need and deserve because I'm just spending time one-on-one with them. Home infusion is a way for patients to get whatever type of medication infusion they require without having to disrupt too much of their lives. They don't have to go to the hospital and be admitted as a patient. They don't have to go to an outpatient setting and sit in a strange surrounding for hours and hours. They can be in the comfort of their own home, and they can get the type of medication that they need infused via an intravenous line so that they're able to enjoy the comforts of their home, get the medication that they need, the attention from a registered nurse that they desire and that they require, and then this way they're able to get a better path on healing and being able to move forward in improving their medical condition.
So home care nursing is a wonderful experience for the patients, but it can pose some great challenges for the nurses that are administering the care. In addition to doing things like intravenous infusions, we also do wound care. We'll check on people to make sure they're following their prescription medication regime, that they're following the doctor's orders. With infusion, we can run into some challenges if patients have reactions to the infusions. So it's not always as simple as it sounds. We do have some patients that require additional interventions on our behalf so that they are successful with their infusion. Sometimes that means stopping the infusion or speeding it up or slowing it down depending on how they're reacting to things. We carefully monitor their vital signs to make sure they're in good standing with the realm that they need to remain in. We also run into the challenge of making sure we're following the doctor's orders. If there are any problems, we can always reach out to the physician and we can always stop the infusion so that we're able to give them the type of care that they really need and have them reach their optimum state of health.
So home care and home infusion is definitely the wave of the future. More and more patients are spending less time in the hospital and still require medical attention follow-up at home. So home infusion is a way for them to continue the care they might have otherwise needed to receive in a hospital setting in the comfort of their own home. And we'll begin to see more and more people moving into this realm of care as the population ages and more people need the required care of a registered nurse.